everyone, and welcome back to Doing Life with Dr. Maria. Thank you for joining us today. For those who do not know me, I am Dr. Maria. I'm a pharmacist by trade and a lifelong learner on purpose. My goal is to educate, inspire, and challenge you to see life from a different perspective. How do I do this? By sharing experiences of others in hopes to empower you to embrace truth and live a purposeful life. Before we get started, please like and share this broadcast. Before we begin our show today, hey Mimi, tell us what's fascinating.
Hey everyone, it's Mimi here with some fascinating tips on how to stay safe when you're pregnant during the coronavirus. So my first tip is you may have to cancel that baby moon. I know on the last video I just told you to travel, but you may want to go ahead and cancel that baby moon. Traveling right now while you're pregnant may be a little risky, so you may want to stay home. I'm not really sure what a baby moon even is. When I was having kids, that didn't even exist. But I guess you take a trip before you have your baby. So you may just want to have a staycation, stay around the house, go ahead and get that last little bit of rest in before your new bundle of joy arrives. My second tip in regards to having a baby shower. Instead of a traditional baby shower, maybe just register online. Macy's, Amazon, Target, Walmart, all those stores have online gift registries for babies. So you can go ahead and pick out what you want. Then your family and friends can choose those items for you and have them sent to your home. That'll keep you from having to have an in-person shower to put your friends and loved ones at risk right now. Tip number 3. Because we can't visit you in your new bundle of joy, maybe send out birth announcements. I know that's a little old school, but that way you can give people something tangible. Everybody snaps a picture and sends it to their phone. But an old-fashioned birth announcement in the mail, that way we can have something tangible, put in our refrigerator, put on our dresser. I just think that'll be a good way to go right now. For all of our 90s R&B fans, here's a little fun fact for you. Did you know that Erykah Badu is a certified doula and has been since 2011? Well, those are my fascinating tips for you today. And until next time, y'all stay fascinated.
Wow, Mimi, that was fascinating. Thank you for those tips. Now on to the show. Hello. How are you?
Good. How are you?
I'm doing excellent. Thank you for joining me today. I'm so happy to have you here on Doing Life with Dr. Maria. Because lately, I received so many calls from expectant mothers asking questions about COVID, social distancing, opening up the country. They're just really concerned. And so I said, what better way to have a double board certified obstetrician gynecologist come on? I'm like, look, let me be the expert right here. So, Dr. Plenty, tell me about yourself.
So I'm from a really small town. So I'm a country girl from Louisiana, called DeRidder, Louisiana. And if you know where that is, then you definitely know about Louisiana geographics. I went to Xavier University of Louisiana for undergrad with the Dr. Maria. And I was Miss Xavier University at that time. And I went on to medical school and got my MD as well as my master's in public health with the concentrations in health systems management. I then went to fellowship at the university, residency and fellowship at the University of Mississippi Medical Center. Then I got married. I moved to Indianapolis. I became division director of maternal fetal medicine there at a network there. And now I am in Houston, in the Houston area, with a private practice in Katy, Texas. So I'm with Obstetrics Medical Group of Houston, which there are 6 of us in our group. I have a dog named Sophie, a son named Harrison, and a husband named James.
All right. Come on now. Y'all, this girl is bad. Like, okay. So I picked the right person to come on today and discuss this. So first question, I just wanted to know, one thing I know that it's stated that women who are pregnant are considered a high-risk group, but that doesn't mean that they're more likely to become affected with COVID.
Right.
Could you kind of explain what a high-risk group is, if you don't mind?
So a high risk group. So you have low risk group, meaning if you are young, you have no comorbidities, you have a normal immune system, you're considered a low in the low risk group. So if you're 35 and you are, for the most part, pretty fit, you're low risk, meaning if you got the disease, you would not get extremely sick. You'd probably be an asymptomatic carrier. However, people that are in a high risk group are more likely to present with symptoms or have some complications from that. So we're looking at COVID versus the flu. Pregnant women are immunocompromised, meaning their immune system is down. It has to be down, right? To basically stop your body from rejecting your own pregnancy, because that's just a whole bunch of foreign cells. So your immune system is naturally down in pregnancy. So anybody that's immunocompromised has a higher risk of getting very sick. So people that get the common flu may have like a mild cough versus women that are pregnant with the flu can get really sick. Like those are my women I'm treating in the ICU. They're intubated on the unit sometimes if they get sick, which is why the flu vaccine is very, very much recommended in pregnancy. So fast forward to this pandemic. COVID, initially we thought, hey, maybe this is going to act like the flu because it's presenting similar to the flu, except for it can have a severe shortness of breath, severe fevers for a prolonged period of time, and people have become much more sicker because this virus is much more deadly. Now, pregnant women looking at them, most of those people don't get as sick as they do with the flu. And we have no idea why. So a lot of our pregnant women are walking around asymptomatic. However, they're considered in the high risk group because they are immunocompromised. So if they happen to be in that subgroup that does get symptoms, they can get them really badly. And after delivery, we have natural fluid shifting after delivery. That's even if you're not sick, because your blood volume doubles in pregnancy. After you deliver, within the 24 hours, you have to, basically your blood volume goes down to what it was before. So you have fluid shifting. So after delivery, people that have issues with high blood pressure, they're more likely to get pulmonary edema or fluid on the lungs. They can be more likely to get kidney damage if they have certain diseases affecting pregnancy. So if you have COVID, in addition to those things, those people have a much higher mortality rate, meaning much higher rate of dying than people that don't. Also, we have no idea what it does to the babies inside, right? Because the pandemic just really started. So those patients weren't in their first trimesters and now delivered. So we don't know what it really does yet. So the data from China says that it's not crossing the placenta, right? So those babies, even with positive moms, aren't getting affected. But we don't know if we're just not seeing signs of that, or if maybe it can cross the placenta if it's very early. So right now we don't think that that's the case. But like I said, it hasn't been around long enough for us to thoroughly study it. So we need more data on that. We do know because the babies after delivery, they don't have much of an immune system. They can get sick from a positive mom. So even if they're not getting it inside of the uterus, which we don't think they do, after delivery, if they're exposed to that mom, they can get very, very sick. And those symptoms of those children present in a vast majority of ways. Some of those symptoms can have, multi-system inflammatory syndrome. Those kids get almost like a Kawasaki's disease with the rashes and affecting the organs. So there's just a lot that we still need to find out about the disease. And because of that, and because those patients can get very sick, if they deliver with COVID, they are considered a high risk group.
So with that being said, because I know that you said that they can be asymptomatic as well, like most of the population can be. And you guys are finding that out with pregnant women. Now, when they get to the hospital, are you guys testing them immediately or automatically for COVID? Is that the protocol?
It depends on the hospital. So I am here in Houston, and so I have privileges at several hospitals. Most of the hospitals that I'm privileged at, they do test you when you get there. If you haven't been tested, meaning if you just present spontaneously in labor, or if you are scheduled for an induction or a C-section, they test you 4 days before. So you get tested 4 days before, and then you get a call and you find out. And then based on whether you're positive or negative, that tells them how to make sure that the staff is prepared for you. Okay. So it just depends on the hospital system. The recommendation from the American College of OBGYNs is to test people before delivery. And that's because, like I said, you can be asymptomatic, and then those patients, because of just natural things that happen after delivery with fluid shifting, can get very, very sick.
Okay, that's good to know as well, because I know that that was one question, because I did have some expectant mothers, ask those questions to me to you for you. And one thing they were concerned about, okay, what if they do have a C-section, or how does this look, or what does this process look like? So tell me, if a mother comes into the hospital, I know every hospital is different, every hospital has different protocols, but in your experience, I don't know if you had a patient before that has had COVID that's coming to deliver, and what does that look like? Is she going to be alone in the delivery room? Could she have someone that was in the house with her, already exposed? Walk us through that process.
Okay, so right now, and I say that because I feel like I have a conference call with about hospital protocols literally like every other day, because things are changing, and it really depends on the state you're in, how the cases are in the county that you're in, and the system, and what they have to actually protect you. So if you're in a system that has currently adequate PPE or protective equipment, patient provider or patient personal protective equipment, then they have enough for you to have a mask and a gown, and for your visitor to have one. So if that's the case, then yes, you will have somebody in the delivery room with you if you have a vaginal delivery. Now, most of the time, if you have a C-section in your COVID positive, you will not be able to have anybody in the OR with you. So what it looks like if you are coming in for your last visit, you're completely asymptomatic. You get tested for COVID. You get called a couple days later. Some hospitals do have rapid testing. The rapid testing has been found not to be as accurate as the standard testing. So that's why they're still doing the 4 days before, unless you present at that time just an active labor. So you would come in, get tested, find out a couple of days later whether you're positive or negative. If you're positive, then they will tell you, hey, we need to make sure that we test the people in your household so we can know if they're positive or negative. So they're doing contact tracing. Then you present with one visitor. They will check your temperature. They'll check your visitor's temperature, and then they'll do the questionnaire for anybody that's coming in and out of the hospital to visit you. If you have a vaginal delivery, most hospitals, the ones in Houston, are allowing one visitor. Even if you're positive, they will allow one visitor with you in the delivery room. That visitor has to agree to wear an N95 mask, and the patient has to wear an N95 mask. And everybody that enters the room has to wear an N95 mask, a face shield, and a gown to protect themselves. Okay. Now, in the event that that person needs to leave, that's fine. They can leave and come back, but they would need to basically do the same questionnaire, have the same temp, even if they know they're positive or negative. They're going to have to do the questionnaire every time they enter the hospital. And if you have to switch off people, because they'll just switch off, that other person would also need to go through the same things. So let's say if somebody had their husband there and they were laboring for, forever, because you can labor for a really long time. And they say, okay, I want my mama here now. I want my mama to bring me some food up here. So the husband would have to leave and allow the mother to come. The mother would have to do the questionnaire, also wear the N95 mask, and then go in. Now, they're not going to be allowed to roam the hallway, okay, because that would be potentially contaminating other things that people touch as they walk, okay? So, but they would be able to sit there in the room with you. Now, in the event that you had a C-section, and I had a C-section, so in the event you had a C-section, they would bring you in the OR. Because a C-section, even if you have an epidural, can cause you to, people cough. They have to, sometimes they have to give you medicines. Sometimes they have to intubate in the middle of the case. Because that's a higher risk procedure, they will not allow somebody else in the OR, okay? And everybody that's in the OR, they're all wearing face shields, as well as gowns and gloves and the N95 mask as well. So if you are a mother or a spouse, to protect you in a high risk environment, meaning there's respiratory droplets that can definitely be spewed, you would not be allowed in the OR, but you would be allowed to wait in the room. And then after the delivery, then the patients roll back and you will be able to be waiting. The other caveat to that is if you're positive And, like I said before, the babies usually aren't positive. We haven't seen transplacental infection, at least not yet. The babies are not with the moms after delivery. That is the kicker for most moms, okay? And they get very upset. No one wants to be around away from their baby after they deliver. I remember when I delivered, my baby had to go to the NICU for a couple hours, and I was like, "Well, where is he at? Where is he going? So you innately have this maternal instinct after you deliver. You want to be around that child. You want to feed that child, and some mothers feel very guilty for not being able to do that. But I always tell people, it doesn't mean you can't breastfeed. They will definitely allow you to pump and encourage you to do that. But they are going to want that baby separated while that mom is symptomatic.
Good. And that's really good to know. Because I'm pretty sure, like, speaking with anybody's obstetrician gynecologist, they would tell you that in that process. So I know I have some people watching this today who are pregnant. And I know that they can take this and run with it and get extreme anxiety, but it's good to know. So I just wanted to kind of put that out there. Like, please talk to your physician as well, and know the protocols in your hospital and what's the case. So that's one thing I wanted to say, because I know after this, Dr. I know I'm gonna get a call from at least 2 people. Okay.
Yeah. And mind you, you can now they are Skyping and setting up webcams so the moms can see and talk to the babies. So and then people that are asymptomatic would be able to see the babies. And if the mom is asymptomatic, then, they're able to wear a mask and see the baby. But if they are symptomatic, it's just not safe. And people feel guilty, but they have to realize that they're doing the very best they can for their baby. And that is the right thing to do.
Absolutely. Absolutely. And I think, that's the best thing. That's the best thing to do for your baby. And I know one thing I want to kind of talk about, and you kind of led into this, we know that COVID-19 affects African Americans at a disproportionate rate due to underlying medical conditions. And I know you talked about that earlier. Should we, as African American women, be more concerned than our counterparts when it comes to COVID, pregnancy, delivery?
Yes. I'm going to say it. Yes. And I say that because I know that everybody socializes and everybody has gatherings, but, African-American culture, or at least people that I know, from Louisiana, we like to celebrate. If there's a baby coming home, we want to celebrate. If there's somebody's pregnant, we want to have a baby shower. And so we do see socializing and gathering, and you see in New Orleans, it's just everything's a celebration, more in minority populations than majority populations. And that's just, this is what it is. And I tell people, we're friendly people. Because of that, we could be bringing COVID back home to Big Mama. And so, yes, I do think that we need to be a little bit more diligent in social distancing and staying away from other people's houses, even our family members' houses, more so than the majority population. And that's just because we're more likely to visit our family members and have gatherings than they are. Plus, we are the people that are on the front lines. Yeah. So we have the most exposures. So people say, well, there's not as many Black doctors as there are, white doctors. So, I don't understand, why they're saying healthcare workers are, on the front line, African Americans on the front line more so. I'm like, you got to realize, like, there's a lot of Black nurses and phlebotomists and medical assistants and grocery store workers and firemen and police officers and bus drivers. And, those are people on the front line. And so you have a lot more people that are domestic workers that are African American than Caucasian. And so we do have a disproportionate amount of people that are of color, constantly exposed to people that could potentially have COVID. And so because of that, yes, I do think we need to be a little bit more diligent in making sure that hey, even if it's somebody's birthday, we need to have a virtual birthday party. Or if you're going to go to somebody's house, make sure they haven't been around other people for the past 2 weeks. Make sure you talk about their symptoms. If they're going to work, make sure you know what type of work environment they're living in. So I don't want to say you have to stay away from people forever. But if you're at home and you're working from home and your sister's at home and she's working from home and neither one of you guys have gone anywhere, then yeah, you can probably safely go and visit each other. But you have a lot of generations in the same households in some situations. So if you have somebody working and you have a child being raised by a grandparent, and there's also like an uncle in the house, well, there's 3 generations of people in the same family. And so that's how we're seeing people and multiple family members in the same family getting really sick because they're visiting each other and they're socializing. So yes, I do think that, and that's my biased opinion, Maria. Yeah. So I do think that people need to be a little bit more diligent in that.
Yeah, I love that, and I absolutely positively agree with you. For those who do not know me, my background is in pharmacy, so I tell people all the time the exact same conversation that I'm having with you. And one thing I'm seeing, and I can ask you this question too, people are saying, well, you're going to die from something. I've heard that so much, and now in COVID, I'm like, really though, but.
But my thing is this, yeah, you got to die from something. And I wish, people that are our age are like, I just want to get it. I've heard that so many times. I just want to get it and get it over with. And if I die, I just die. Okay, but how would you feel if your grandma died and you were the reason your grandmother died? So it's not you need to be worried about. It's other people and their immune system you need to be worried about. So my son has an immunodeficiency. He has low neutrophils. And getting this, basically we're down workup right now. I worry about him. I don't worry about me getting sick. I'm trying to make sure I don't bring it back home to him and he gets sick. Mm-hmm. Likewise, if I tell my mom, who is pretty healthy, she's in her 50s, she's in her late 50s, she's young, she's healthy. I tell her, when you go visit your mom that's almost 90, like you don't need to go anywhere for 2 weeks before you visit her, because my mom would probably fully recover. She doesn't have any medical problems. But my, 88-year-old grandmother, may not be recovering. She has hypertension and diabetes. Mm-hmm. So she's more likely to die than somebody else that doesn't have those diseases, and then somebody that's younger than age 60. So we have to think not for ourselves, but for the people we love so that we're not infecting them.
That is a very good point. We're doing it for the people that we love.
Yes.
Don't be selfish, right?
Don't be selfish.
Don't be selfish. And one thing too, as we talk about going to visit people, and that the country is starting to reopen, and this is my biased opinion. I think we are reopening too soon. That is me. That's why
I agree with your biased opinion.
And we see that cases are on the rise. What precautions are you advising your pregnant patients who might be returning to work? Or returning to a new norm of life, because some jobs are saying that they have to come back into the office. What would be your advice to them?
So for most people, if you're pregnant and you're at the beginning of your pregnancy, meaning you are likely to be an asymptomatic carrier, get over this thing and keep on with the pregnancy. I tell them, yes, I think you can go to work if your work will allow you to practice social distancing and wear a mask. Now, pregnant women with a mask, we already have a decreased respiratory reserve in pregnancy, meaning there's natural physiologic things that happen in pregnancy that will not allow you to take a deep breath. In pregnancy, you can't hold your breath as long as when you're not pregnant. Physiology tells us that, okay? So if you're talking about a mask on for 8-hour shift, we're not going to be able to do that. So one, they have to be allowed to have frequent breaks. And we do write them a letter that says they have to have frequent breaks so they can exit the room, take that mask off, breathe somewhere else outside, and then put the mask back on. 2, you do need to practice social distancing because you are a higher risk population, meaning if you end up having preterm labor, that would be detrimental. So you have to do that. And then if you can work from home, then you should work from home. So they are the exception. So if you've been working from home and now your job is open back up and you need to go to work, well, then there's a chance you can still work from home. Otherwise, you would have never been able to work from home. So I usually write a letter that says, please excuse this patient. She is a high-risk patient and she doesn't need to work. And please allow her to work from home as possible. And for the most part, people have been okay doing that. If you have hypertension, diabetes, or you're very late in the pregnancy, I urge those patients not to work. Like, let's just go ahead and fill out your FMLA stuff now, because if you get sick, you can get really, really sick. You could even die. So for those patients, I don't want them to work. And honestly, I wish that none of the pregnant patients would work if they could not practice those parameters. If you can practice those parameters, then you will likely be safe.
And that's one thing you did say. I remember that was really good when you were talking about like social distancing, practicing the parameters, writing them a letter. But one thing you did mention as well is talking about preterm labor. Now, I've heard you say that before, and just even in doing my own research, you were talking about preterm labor with additional stressors. Can you kind of explain that, how it correlates with even COVID-19?
So anytime you have a respiratory illness in pregnancy, that means that if you're short of breath and you're not getting good oxygen and your oxygen content is actually lower, then your uterus is not getting good oxygen. The uterus is a big muscle. And so just like if you're exercising and your leg starts to cramp, right? That means that leg muscle isn't getting oxygen to it, okay? And so you have a buildup of lactic acid. Same thing with the uterus. And so whenever the uterus gets, dehydrated, quote unquote, you can start having contractions. And that's a big reason that some people have false labor, just because they're dehydrated. Okay, so decreased oxygen content can cause that. And then we know that people that have a decreased reserve and an infection can be at increased risk for just going into preterm labor, okay? Because your body is naturally going to try to save itself. The uterus is going to do the same thing. If that uterus is not doing its job, meaning there's not good enough oxygen content delivered to the mom, therefore you're not oxygenating your bloodstream well enough, and then the uterus is not getting good blood flow, meaning the placenta eventually doesn't get good blood flow, and the baby is not getting good blood flow. Eventually your body will naturally say, okay, it's time for us to deliver, because we're trying to save ourselves and we're trying to shift all this stuff to the vital organs, meaning the brain and the heart. And in pregnancy, the uterus gets about 45% of the blood flow. So it's a vital organ as well. But because you're sick, you're more likely to go into preterm labor. Okay. And so obviously you want to do things that prevent you from getting sick so that you can avoid going into preterm labor. Now, some people are just predisposed to go into preterm labor for various reasons, right? Some people have a history of preterm labor. Some people have a short cervix. Some people have cervical insufficiency, meaning their cervix just can painlessly start to dilate. Some people need to deliver preterm because they have issues with high blood pressure or uncontrolled diabetes, or their baby may have an anomaly. So there's other reasons that people can go into preterm labor. But if you go into it with COVID, it's much more detrimental than if you did not have it.
Wow. That's good. And I think that's a very important. That's why you have to practice.
Right. You don't want to get it.
Yeah.
Like, you don't want to do anything that can increase your risk of having a bad pregnancy outcome. And I've seen people that didn't believe that COVID existed. I still have people to this day telling me, asking me if COVID is real, and I tell them, "Are you serious?" Not believing that COVID is real.
Right.
Some people are still in disbelief. So my pregnant women that are like, "Oh, I got to go shopping. I got to go to Bye Bye Baby, and it's open now." I'm like, you can order that online. Like, we have to really be smart about when we're going to allow ourselves to be exposed, right? Yeah. So there's some things we can do the smart way. Meaning, if you need a crib, you don't want to haul that thing in the house and unpack it anyway. Just put that thing and have it delivered to your front door. It's much easier to do that. If you have to go to the grocery store, do the click list and have them put it in your trunk. You don't have to go into the grocery store. Now, some stuff you may have to go into the store for. And if you do, wear a mask. You don't have to wear gloves. I see people walking around with gloves. You don't have to wear those. Why? Because you're going to get in your car with those gloves, and now you've had the gloves on way longer and you haven't used sanitizer, and you would have at least used sanitizer 3 times if you didn't have gloves. Right. So you don't have to wear the gloves, but you definitely need to wear something over your nose and mouth. And so if you have to go somewhere, protect yourself. Wear a mask. We know that decreases the spread of this virus if you wear a mask. So be smart about it and wear a mask so you don't get sick.
Please, come. Thank you. Thank you. Thank you. I mean, this is good. Like, yes, wear a mask, and you do not have to go to get the crib.
Yeah.
Order it. Just order it. because I mean, this is good advice because we're trying to help you. We're trying to help you to help your baby, right?
Right.
And so one thing for those mothers who, and I know as a nation, it's so much going on, and people are experiencing, depression, anxiety, stress. And I know even I told somebody some days you can have like 5 different emotions in one day. You don't know what's going on.
Yesterday, yes. You don't even know what emotion to feel right now.
Right, exactly.
Yeah.
How do you tell your patients to stay calm for the health of the baby? What tips do you give them?
So the number one tip I give people is take a day, get off social media, turn the TV off. Because if you stay and you watch the TV all day, I mean, it will suck you in because you're in disbelief at the things that are happening. The protests, which need to be done, the protest that's happening, and then you still hearing reports of people getting killed. I mean, it's almost like people don't even care that we're protesting. It's still killing people. And so because of that, it can become very overwhelming. I'm not pregnant, and it's psychologically, it has an effect on all of us. I was telling a friend, I was like, we all need to get some counseling at some point in time through this thing, because this is taking a toll and people don't even understand how it's taking a toll. So I tell people, take a break for a second, hit pause, turn the TV off, turn social media off just for a day. Get some fresh air. Pregnant women do need vitamin D. That's a real thing. Vitamin D deficiency is a real thing. And so you don't want to not ever go outside. You do need to go outside. You just need to practice social distancing when you do. So walk outside, sit on your porch, have a picnic in your living room with your spouse. Do something creative, make something. Start a blog, write a book, do something to distract yourself for a minute. Because if you constantly sit and watch TV, then days and weeks have gone by and you've done nothing except for brainwash yourself in the TV. So that's one thing I tell people. The second thing is, you may need to talk to somebody, and there's nothing wrong with talking to somebody professional and getting some type of counseling, because it's hard to deal with your emotions, especially if you've never had to deal with the fact that, hey, I'm being discriminated at work, especially if you're in it at that moment and you're being discriminated against, or you've been affected because somebody has died from police brutality, or somebody has COVID, or somebody's in the hospital and you can't go see them. That all takes a toll. So yes, I do encourage people to talk to somebody professional. I will refer them to psychologists or psychiatrists or behavioral health specialists so they can seek therapy. And then the last thing I tell people to do is, if you get prepared now, especially if you're pregnant, get prepared now so you won't be stressed more later. If you're pregnant and you don't know what you're going to do, meaning you're not working and you're lacking resources, research those resources. Go to your government sites to see what you can get to help you and get some assistance now. People have a pride issue when it comes to admitting what they have and what they don't have, because they think that nobody's here to help them. There are a lot of resources out there to help people through this, this whole COVID thing, to make sure that people have cribs and beds. A lot of the public health departments have programs set up for that, because they know that people are still having babies, more so getting pregnant now because you're standing home looking at your spouse all day. Than before. Right. So there are resources, ask your provider. Some of those resources are going to be state and county dependent, but let somebody know what you have. And then 2, you're going to need help when this baby gets here. I know people think, oh, I can do this, it'll be fine. I'm not going to have anybody at the house. Like, that is unrealistic. If you have a baby, you're going to be up every 3 hours. And so really what you need to do to drop your stress now is prepare and make sure you're going to be good at the time of that delivery. So I always tell families, if you'll want your mom here, make sure your mom goes to the grocery store, stacks up on what they need for 2 weeks, stays at home for 2 weeks if they can, wears a mask consistently. And that way it's going to be safe after you have the baby for them to come over and help you and stay for longer periods of time versus them not doing those precautions. And then you're stuck because you're like, do I want to expose my child and myself when I don't know where this person has gone and I don't know who's been at their house, or do I want to, not have the help? So you shouldn't have to choose between those two. So have an in-depth conversation with your family to prepare for the help that you need, and get the resources that you need. Those are things, to me, in my opinion, that will decrease stress now and later.
And so that, in saying that too, having that conversation. So, because it all ties into pride and having those difficult conversations.
Yeah.
Would you suggest, say, I'm just going to use me as an example.
Sure.
I am the type of person who I really don't necessarily like confrontation. Like, I just don't like it. I'll write you a letter before I tell you how I really feel. I just don't. So for those people who say, like, I can't tell my mother-in-law, like, just stay home for 2 weeks. How would you suggest they word that, for the safety of the baby? What would that conversation, or how should that conversation look?
That conversation should be a phone call or FaceTime or what have you. And, first just ask, what is their day-to-day like? Are you going to work? And, I'm due at this time. My OBGYN said I'm probably going to need some help, but that the baby would be at risk if they're around people in public. So I always tell people, blame it on me. Blame it on the doctor, okay? And literally say, my provider says that I'm going to need help, but I don't want to expose my baby. So she's told me to make sure that the people that are around me are not around a lot of people for the 2 weeks and that they wear masks. Are you going to be able to do that? And I don't think that there's anything wrong with asking, are you going to be able to do that? Because if you're not going to be able to do that, then there's your answer. That's not the person that needs to come and help you. Okay. Now, if it's your in-laws, they're going to be real mad if they can't come and see this baby. So 9 times out of 10, they will bend over backwards to make sure that they're doing the things they need to do in order for them to be okay coming to visit for a couple of days to see this baby and help out. Okay. But if they're not, I know you don't like confrontation, but that mama bear in you, Dr. Maria, when you have that baby, let somebody try to expose your baby,
Mm-hmm.
Then you may be okay with a little confrontation, right?
Mm-hmm.
And there's a way to say things. You don't have to be nasty about it, but do say, this baby can get really, our baby can get really sick if he's exposed. So I'm sorry, but I can't allow you to come over here if you're going to, continue to go to the movie theater.
Yeah. That's good.
Open here.
Right. Right. Like what you blame it on the doctor.
Right. Blame it on us. Okay. The doctor said that my baby shouldn't be around people that have been in the public because the immune system is down. And that's a real thing. Like, the doctor will tell you that this newborn baby should not be around a lot of people. And even before COVID, the doctor says the baby shouldn't be around people. And if you are, wash your hands, before you hold the baby, and you can't be sick, holding the baby. Same thing goes, except for these people can be asymptomatic and carry something to your baby. And so you can't really go based off of symptoms. So you have to make them take the precautions before.
Oh, that's good. And I know, so one thing too, before, because I want to shift gears a little bit and talk about pregnancy pearls. But before that, I wanted to kind of, you talked about before about the placenta and what you've seen with studies have shown that it cannot be transferred, or hasn't, as of yet, it hasn't been seen to transfer to the placenta. But also with breastfeeding, those mothers who are thinking about breastfeeding, what would you recommend for them during this time?
We still want them to breastfeed. So we know that breast is best. And we say that, and it's not to guilt trip anybody that can't breastfeed, because I had a difficult time breastfeeding and I had to stop myself and switch to formula. So no judgment zone here, but that the breasts have natural antibodies in it. So if your body is making antibodies to COVID because you have COVID, then we know that those babies can be less likely to get infected and get severely sick. So we want you to continue to breastfeed. The only thing we ask moms is, when you do, make sure you wear a mask, even if you're pumping and, and you're asymptomatic, wear a mask, make sure you cleanse the breast first, then attach the cup, and then immediately put it into a storage container and then put it into the refrigerator if you're not going to use it right away. But yes, we are still encouraging breastfeeding even if you've had or have COVID.
Okay. Yes. And that's good to know. And that's one thing when you say clean the breast as well. That's, I that's good to know. One, listen,
usually you're just like, pull your shirt up and, pull the little snap on the bra down and attach it. Now, usually you be like wiping with a wipe anyway, but you just have to take that extra step and make sure that you are being really thorough before you attach the cup and or breastfeed.
Wow. Yeah. That good point, y'all. Now you know. So just shifting gears a little bit and kind of talk to us about pregnancy pearls, because that's something that's you recently started. Could you explain to our viewers what that is?
So I recently started Pregnancy Pearls with Dr. Plenty. It's basically my way of making sure people have information. So as a director previously, I had a lot of patients I did consults on that would ask me just honestly very low risk questions when they saw me, things that they probably could have asked to their OBGYN, but their OB was either rushing, had to step out for a delivery. They may not feel comfortable with their provider asking those questions, or they may have felt like, oh, I forgot to ask that question when I was in the office. And so a lot of patients will send messages via my chart and wait days to get answers, or, call and can't get in touch with somebody. And so I wanted to create a platform for people to, one, ask questions that I can directly address, either through videos or directly answer, like just literally email them right back and answer their question. Or schedule them to a time to actually talk to me and on the phone. So I wanted to make sure that people had an avenue to ask these basic questions and some high risk questions. I find that if you are African American, you are less likely to ask your questions to your OB that is not African American, and that may have something to do with the distrust in the healthcare system. We all know that there's been a long-standing history of abuse in the healthcare system of people of color. And so those patients, when they see me, they're almost relieved, Maria. They're like, oh my God, I have a list of questions to ask you. And they'll go through them and they'll say, I just didn't feel comfortable asking my OB. And so I know that my patients aren't the only patients that think that. And so I wanted to create that to give people, not just people of color, but all women, a direct access to somebody that does high-risk pregnancies and can answer those questions for them.
Wow, that speaks volumes, because as you were talking, I was even thinking of a couple of my friends who are actually in the healthcare field themselves, not necessarily pharmacists, or they're doing something in healthcare. And I remember conversations with them. They're saying that when I go in, they make me feel like I'm less than, or I don't feel like comfortable enough to ask those questions. So that just kind of sparked that in my mind for you saying that. And I commend you on doing this, because I know myself personally, people who are afraid to ask questions, and you can say, and they're, I guess, considered highly educated people who don't want to talk to their OBGYN just because of the same thing. They feel uncomfortable.
Yeah, and some people feel uncomfortable, not just because they're like a person of color. Some people just don't want to ask certain questions. Like the questions I get asked, people don't want to ask questions about sex. Well, how you think we got pregnant? So they don't want to ask questions about like sex and like changes their body naturally has. People have problems asking questions about discharge or odors. Like people don't feel like their OB is going to be comfortable answering those questions for some reason. I tell people all the time, like, we can answer, nothing is going to surprise me that you ask. I've seen it all. Nothing is surprising me. So I have to almost try to pull questions out of some people. And the husbands, when they come, they'll ask the questions about sex.
Really?
Oh my goodness. Especially if the patient is having some issues with preterm labor, or they've had a history of a preterm birth in the past, they'll say, is it safe to have sex, or when is it safe for us to have sex again? Now they'll just straight ask it. And you'll just, oh, I can't believe that you asked. That's so embarrassing,
Right. Right.
I never ask these questions. let's go through and answer these questions. Because some people just think, that's just, taboo. You're not supposed to ask those types.
Right. But look, the husband's like, look, no,
we need to know.
Right. Let me ask mine, okay?
Right.
So one thing, and I love, because I did some research on, pregnancy pearls with Dr. Plenty. For those who do not know, definitely check out her vlog. It is very informative. A lot of information, great information. I'm like, let me take notes, when that time comes. Let me make sure I have notes. So I do appreciate you building this platform. And one thing, and you mentioned this before, we were talking about like health disparities, and as we all know, there is an increased rate or risk of African American or women of color dying during childbirth. How is your platform helping answer those questions, or helping bridging the gap between the healthcare field and pregnant or expectant women of color? How are you bridging that gap to decrease that number?
Sure. My attempt to close that gap is through advocacy. So it's empowering women to be comfortable asking the questions that they need to ask. And so some people don't understand that if you have a headache, that's a big deal in pregnancy. Like if you take some Tylenol, you still have a headache and you're pregnant, that means you need to get checked out. That doesn't mean that you need to go to sleep and sleep it off. It means that you may have preeclampsia and you need to get checked out. And so it is making sure that I am educating people and encouraging people to ask these questions. And so each one of the topics that I talk about, you'll hear me say, ask your OBGYN X, Y, and Z. Ask them about these resources, because a lot of people just don't ask. And I'll see people that are, sick as dogs. And I'll ask, well, why didn't you come in earlier? And they said, well, I didn't know. Or I tried to call my OB and I didn't know what to do. So I just waited until my appointment, or I waited until I had to call the ER, the ambulance. So it's empowering them through education to advocate for themselves.
I love that. Empowering them through education to advocate for themselves. And I think that is very big, like even in across the board for in healthcare, just telling patients to be your own advocate.
Absolutely.
Do the research. Even if you don't know, that's why we have platforms like yours. That's how we have platforms like this, Doing Life with Dr. Maria, to have experts like yourself come on, because we want you to be your own advocate.
Right.
It's very important. If you don't feel good, like I mean, even personally, I've had patients who are taking a medication and they stop taking it, and now I'm reviewing your medication list. I'm like, well, why can't you take this? Well, it gave me side effects, or I didn't feel good. I'm like, call me, tell me, so I can get you on something else.
Right.
So
you don't know what to, right. You don't know that you need to switch the medicine. You prescribing and thinking they're still taking it.
Exactly. They still taking it, going on about their business until it's too late.
Yeah.
So I love that. Let us know, tell people how they can get in contact with you. And do you have anything else coming up where they can, hear from you, or any webinars, interviews, so people can know how to, reach you?
Sure. So they can reach me at pregnancypearls@gmail.com if people have a direct question. I am on Instagram at pregnancy_pearls. And I'm also on Facebook as just Pregnancy Pearls with Dr. Plenty. Same thing as my YouTube channel. And so I always tell people, one, don't be afraid to reach out to me directly. I know you don't know me. You may not know me, but I will answer your questions pretty promptly, pretty right away, or I'll set up a phone call. I don't do like charge consults. Nothing I do is of charge. Everything I do is free. And so if somebody wants to have a conversation, I'm more than happy to do that. I do have an upcoming webinar with the American Medical Association that should be launched in the next couple of weeks. So that's coming down the pike. And then I should have a new video coming up in the next couple of weeks about the pandemic and how it's affecting Black Lives and Black Lives Matter and that movement.
Great. Thank you. Wow. Is there anything else you want to say to the audience? This has been a great interview. Anything else?
Well, I appreciate you allowing me to come on and talk about pregnancy pearls and just talk about pregnancy and COVID. You have been a blessing to a lot of people, including myself. Keep doing what you're doing, Dr. Maria. You are blessing people through education. For all of the people that are pregnant, just stay safe. Make sure you're practicing social distancing. If you have questions, do not hesitate to ask questions. That's what healthcare professionals are there for. Make them work for their money. For some reason, people of color, if you ask questions, it's almost deemed as if you're challenging somebody. That's not a challenge. They're there to answer questions. Like, that is our job, to make sure you have the information that you need. So please write your questions down, bring those questions with you to your visit. Make sure you get answers before you leave and write those down. And if you have any questions that you're confused about, reach back to your OB, or you can send a question to me via email. I'll be more than happy to answer them.
Great. Thank you so much. And thank you for the compliment. I love to have you back on one day, just discussing, whatever you like to discuss. Cause this is bad. Okay.
Well, thank you so much for having me. I appreciate it.
Absolutely. And for those who are watching for the first time, again, my name is Dr. Maria, and this is Doing Life with Dr. Maria. And I always like to end the show with, today is the first day to the rest of your life. So tell me, how are you doing life? Bye, guys.
Bye.